So let's tackle some of the physical aspects of where folks live and work and how does that impact on the health of the community. So let's start here in Philadelphia. So again, poverty being a key social determinant, regrettably in our country, probably the most important social determinant of whether somebody's going to be healthy, and the proxy we use for that is zip code. Here in Philadelphia, 1 out of 4 people live in poverty. Of those 25%, half live in what Uncle Sam calls deep poverty, which is a euphemism for can't put food on the table, so there's food insecurity on top of deep poverty, which is a horrific social problem. That's 400,000+ people and children going to bed hungry every night in America's founding city. And then areas of this town that are going through rapid gentrification then displace folks who don't have the resources to pay rent in their own town, or in our case, their section of the city. Philadelphia, on the positive side, has had a net migration into town, but you have to look at who those folks are. There's 2 categories: highly educated millennials and empty nesters like yours truly. So these are the 2 core groups who are moving into the city, which even in the last just 2 or 3 years has had net migration in after a decade, more than a decade of net migration out. So how does that affect health? Well, folks who can't afford it they're in a jam, and we have an inadequate low-income housing stock.